the South Asian Heart Center at El Camino Health. El Camino Health is a hospital system in the Silicon Valley in Mountain View. And we were established in 2006 as a non-profit organization, much like the SKM Foundation, to reduce the high incidence of diabetes and heart attacks with culturally tailored, science-based and lifestyle-focused services. So our team that you can see together here is a small staff, which includes a medical director who is a cardiologist, but the remainder of the staff is dietitians, other physicians, and community members who have chosen to kind of volunteer at the South Asian Heart Center. And so this is a very dedicated team, and I'm very proud of them, of their work on a daily basis. So we have put together a program called the Aim to Prevent program. And many people at the conference have asked me, you're not a physician, what got you started with this? And I mentioned before that my journey from software to healthcare has been because of my own personal kind of history with heart disease and a heart attack at the age of 44. And that kind of shook me up, as it should. But the more important thing that I learned was there was a great chance that I might have just passed away with that heart attack. And this realization actually happened 6 months after the heart attack, because I immediately got stents in and life was as usual. And I see that even today as people get diagnosed, they'll go to the hospital, get a stent, and then it's life as usual. So it was life as usual for me. And then at my birthday, about 7 months later, I was back at work and I was celebrating it with my team. And this lady comes up and said to me, and she says, Ashish, I'm so glad you're with us. And I don't know what prompted that. It must have been really, really important, because that made me think that, you know, I'd already forgotten about the heart attack. I'm here kind of life as usual. Although it did shake me up tremendously. Then I said, okay, I've got to do something about this. And I started researching on this particular issue, and lo and behold, the first person I read about on this was Dr. Ines Ines. And so we invited Dr. Ines Ines to come over to Mountain View to kind of give a talk on his findings and what can be done about it. And I started implementing a lot of the things that were talked about in his book. And with that, we kind of said, you know, this is something that is preventable. This is something that we should look at for the community. And El Camino Health is a very, very good community health partner. And so we got this started at El Camino Health as a non-profit. So we are not funded by any operational funds. We get grants to run the program. We go to donors and ask them for money. And we have some small amount of participant fees that cover the cost of the center. So we put together this structured program called Aim to Prevent. It's a one-year program that is now run as a virtual 100% telehealth program. And it has these 3 areas that we work on with individuals. The assess is to screen individuals for their risk for cardiovascular disease and diabetes. The intervention is to educate individual, and I heard about this education bit so much as well, that education is really necessary. At the time that we started, we had to educate both the community, but also physicians who were unaware of this increased risk. And then finally manage, which we think is the secret sauce for the Aim to Prevent program, is about having a health coach support you through that journey of lifestyle change that we're talking about. And that program is a full 1-year program, because we felt that, you know, 12 weeks is not enough to constitute a sustainable lifestyle change. So we are actually, this program is in, we have got participants from 38 states in the United States, and we have, any physician can access our services from and refer patients to us. So we do a full assessment for individuals. We do a heart health risk assessment, which is a series of questions that we ask them about their demographics, about their lifestyle in particular, looking for things that can put them at risk. We also do a comprehensive lab for them that includes cardiovascular risk factors, diabetes risk factors, hypertension, that we do through the exams, etc. We optionally offer them the CT scan for calcium score, and then we put that all together in a report on one page that kind of summarizes your risk profile. And that really helps individuals understand all of the areas that they could potentially work on, which can be modified. In the intervention, we have created a program called MEDS, and I'll cover that in a little bit more detail, for meditation, exercise, diet, and sleep. Now you might ask, and this was mentioned by Dr. Yusuf multiple times, smoking cessation. We found that the people that are coming to the center, there was a low incidence of smoking, or self-reported smoking, as I should say. And yes, those individuals get help on smoking cessation, but for most part, we work with individuals on these 4 areas. And it's called meds. So these are your other meds that you need to have. And then finally, in manage, we have a very structured health coaching program, and community volunteers give time to actually become health coaches with the South Asian Heart Center. So we have a very robust training program for coaching that not only brings people up on the clinical side, but coaching by itself is an art. And so all that we know about what makes coaching work. All right, so what are some of the learnings? And I put together the top 10 things that I can bring to the table here. And the first thing is, what, South Asian? Really? And the reason why I say this, and Dr. Irani was just talking about heterogeneity in South Asians. But the first thing is, South Asians don't identify themselves as South Asians. You ask people, I'm Bangladeshi, I'm Gujarati. That's how you'll get answers. I'm Southeast Asian. They actually, connect themselves up with Southeast Asia, but not South Asia. And so when we go about talking about prevention in South Asians, it's difficult to kind of get them together. Yesterday I was just observing, when you call people up to party, they are here. 350 people showed up, right? But when we are talking about a South Asian cardiovascular disease conference, then you don't get the audience because people don't relate. So one of the things that we have to really think about is how to label this issue so that people know it's their issue and get ownership of that issue. One thing that we did right in labeling, although the South Asian Heart Center is the South Asian Heart Center, we did the same flawed kind of logic with it, but that was 16 years ago. The second learning is, and you saw so many presentations, Dr. Kanaya's presentation on adiposity, everybody kind of talked about body mass index. And the reason why this works as a yardstick is because people feel it and see it and worry about it. Not the BMI, they worry about the weight, right? Cardiovascular disease is silent, it's kind of happening and you don't even know, there are no symptoms. You don't get affected by it. So this is a thing that we could rally the community around to kind of work on. And I love Dr. Rajgopal's thing about measuring every day, just at the same time. And even if there's a half a point difference, it is significant. What I usually tell people is that when you see your weight rise, for whatever reason, that's when you know that there are some metabolic abnormalities happening. Some lack of balance in the body. And that analogy kind of starts working with individuals. The third thing, and these are screening related kind of things that we've learned, the coronary CT scan. If you're not doing it already, started, we found that not only does it diagnose CAD, but it's also the preferred trigger for change, right? But it is more real to people than telling them you have some risk factors for coronary artery disease. Okay? And we introduced it when it became affordable, and it reached a tipping point where it was both affordable and also the radiation was contained, so that we could send this as literally a non-invasive test for them to kind of get moving. The fourth learning was that lifestyle is so unstructured that you have to structure it for individuals. How many of you have done Art of Living? Yeah, so a few hands, but Art of Living has done a beautiful job of structuring your breathing. Right? We talk about how important it is to breathe. Art of Living was the first organization that actually put together a course on breathing that you could follow and you'd know exactly what to do. So that's why we focused the center's energy on creating a lifestyle program that was structured. And we called it MEDS, M-E-D-N-S. It just so happened that it had this cutesy name associated with it. They're parallel and people understand MEDS, right? And we could easily say that these are your other MEDS. And many people want to try this out first. We heard that today, that they are not willing to take up medications, but they are willing to try something on lifestyle. So it's lifestyle focused, culturally tailored, and evidence-based. Now, the biggest thing about lifestyle, if you go, every single physician will talk about exercise and diet. That's the topmost prescription that's there in an internal medicine or on cardiology clinic. Exercise and diet, exercise and diet. Right? And you may not even get prescription for medication when you go to a doctor's office. Exercise and diet. The problem is not the prescription itself. The problem is that there is no place to dispense that like you would with other prescriptions. You are on your own. So Google it is. You might get scared when you visit your physician. You go up to Google, you find out what you need to do with the lifestyle, and then you find, yeah, I need to exercise 150 minutes. And then you start implementing that. And you'll soon see how difficult it is to put 150 minutes of exercise. 70% of people who come to the South Asian Heart Center have 0 minutes of exercise. 0. So you can kind of see, and we saw so many slides talking about the low level of physical activity in this population. So the problem is not the prescription itself, it's where it's getting dispensed. And providing people support for that exercise and diet. So that's what we did. We transformed the center into a lifestyle pharmacy so that physicians could refer people to the South Asian Heart Center, and we would take care of supporting people through their journey of lifestyle. So then the thing came about is that we had to kind of parallel everything about it as a prescription. So the number one thing was we needed to put the science behind it as much as you would in any drug that's out there, right? So we created all of that science around each of these modalities that we structured into very lovely workshops and presentations for individuals. And we found a tremendous change in people accepting it, right? Because when we talked about hours of sleep, they wanted to look at data. When we talked about minutes of exercise, they wanted to look at data. So we put all of that together for them and made it so that it was science-based. The four things came about because exercise and diet was already there, that was part of the prescription, right? The meditation and sleep, and some doctors would do sleep too, but the meditation and sleep were actually put in as binding agents. What we found by adding the rest components to the exercise and diet, that everything actually came together. That people started doing more exercise and working more on the diet. They found time to exercise because they were adequately rested. They were able to kind of get that. So that was our binding agent. It became bioabsorbable, just the way that we kind of want to have our medications absorbable. So it was a true parallelism with real meds, but focusing ourselves as a lifestyle pharmacy. So that's meds, and we call it the risk reduction technology to the South Asian Art Center. And when I go and meet so many members of the community, they'll start talking about meds already, because it's just so easy to understand and get there. Now, people don't get to all of these pillars at the same time. Most of them take it one at a time, and that's why we need the time of 1 year to kind of work with them. Meditation perhaps comes the last, but also it's a cultural piece that we wanted to make sure gets incorporated in the rest component, and the quality of rest achieved through meditation being different from the quality of sleep, and a different physiological change with it as well. And so we wanted to provide the science for that to individuals and be incorporated. The fifth thing that we've learned, there are lots of learnings, unfortunately I won't be able to talk about all of them, but we discovered this 595 rule about measuring, right? So we insist so much on measuring everything at work, we big data, all of that stuff. Everybody's measuring every single thing. In financial systems, it's all about the numbers, right? And people will know to the penny what's in their bank accounts, right? But you ask them what is their LDL level, and they won't remember what it was from 2 months ago, literally, or maybe even last week. So people don't measure lifestyle. That is one of the things that we found about it. 5% do, and we ring the bell for them, and they make tremendous amount of change because they see it. Just weighing yourself in the morning, once a day, gives you great insight about you. And that's kind of what we start working on with people. 95% of the folks just wing it. And I'm one of them, right? I'll measure, I got my aura, the ring that measured the sleep. I was on it like the first week, I knew every single day what was happening. Now it's there. And I look at it, I look at trends from it more than on a daily basis. But so you wing it. Now look about food. How many of you calorie count? Just honest. Right? But you've heard about it, right? That it's there and important. So nobody counts calories. How are you going to make a difference in somebody's dietary habits if you're going to give them a tool that they cannot use? So we are going to talk about tools, things that we have done on the diet side that have been very, very effective. And making it simple, almost brainless. So that's why I made you all do this at the beginning and showed you the closed fist. This was the reason for it. This, from now on, is your new measuring cup. You're going to measure everything by fistfuls. You're big, you've got a big fist. You're small, you've got a small fist, right? So it's a self-regulating, self-calibrating cup. And you measure everything based on that, okay, your fist. The other thing is that you're always carrying your measuring cup with you. So there's no excuse. When you go to the restaurant, you can measure your food with your fist, right? And what do we measure? The only two things that we are going to measure is fruits and quantity of fruit and vegetables. 1 fistful of fruit, 2 fistful of vegetables. You want to have at least that much. And then you can talk to me about coconut oil. And I'll talk. All right, you get your 2 fistfuls, it will do more wonders for you than having that argument about coconut oil, literally. So making it simple was really important. And we really like this fistful, people really get to it, and they mentally kind of take their fists with things that they eat. And I'll continue on that with the next few things that I'm going to talk about. So how many of you have heard the plate method? Yeah, so if you have, fantastic. So we have, of course, culturally adapted it, and we kind of put together a picture of what an Indian plate might look like or a South Asian plate might look like, but it's a game changer. Complete game changer. For 2 reasons. One, that it not only kind of gives a way for people to visualize, they can actually start arranging their food on their plate this way. You know what this replaced? The plate replaced what other tool? Anybody? The pyramid, right? So there used to be the food pyramid before. Well, the food pyramid gave people license to pile up food on their plate, right? It was the pyramid, right? So it was completely not something that worked for individuals. It was very hard. It was still percentages. How do you measure the percentage of, carbohydrates, fats, proteins, etc.? Right? This changed everything, and it became very easy for us to explain to people. This is a wonderful tool when you are in a buffet line, because we tell people to do a parikrama of the buffet line. So don't pick up the plate, you just go around the buffet first. You spot the foods that are going to go on your plate and different places on your plate. Then you pick up your plate and you go. And so once you just do this, like taking a deep breath, right? Suddenly things change. You are more calm and quiet. That walk around the buffet table is wonderful, because you know what to pick up, what not to pick up. It just becomes so easy. So the plate method has been a game changer, moving away from counting to visualizing. The seventh learning has been walk before you run. We have a lot of engineers who come into our program, and they see their risk report, and they see a bunch of reds on that, right? And their first question is, how much exercise do I have to do? I'll just do it. Right? So we tell them 150 minutes of exercise per week, and they might be at 0, right? So the engineers in them will actually do all the 150 minutes on the same day, literally. And then what happens? Injuries right after that, right? So now they're knocked out for 3 months, and we've lost good time that we had with them. So literally, it's walk before you run, baby step approach to behavior change. Getting somebody from 0 to 150 takes time. Even, the fastest cars, 0 to 60, which they talk about, takes time, like a few minutes, seconds to kind of get there. Here, people want to fast forward very quickly, and that doesn't work. And, the other thing that happens with that fast change is that it's also easy to revoke it, right? You're great first week, second week, third week, and then that energy dies down, right? Because life has a way of taking over. So this has been a very, very important step of learning and in what we talk to people about. The next 3 points, which is the 8, 9, and 10, are all about your interactions with us as we coach you through lifestyle change. And the first one that I want to do is to talk about dancing versus wrestling. We have this tendency, and especially a little bit more culturally, they are prescriptive. You should, right? And then we at the South Asian Arts Center are no different from what you are hearing at home. You should, right? So we move that dialogue from the you should to have you consider. So I just want to give that one thing as an example. Is just leave the decision on the other side. We provide them the science, and then they make the decisions. So this dancing versus wrestling is a technique that we have used in our health coaching to create an environment of trust, create an environment of collaboration, and create an environment of change. So those are the things that we are kind of looking at this. And dancing versus wrestling is exactly the change in the way we approach getting people to do stuff. We never ask people to do things. They tell us what they are going to do. And it's a very important distinction. When they tell us what they are going to do, it's more likely to happen. When we tell them, you need 150 minutes of exercise, it's no different from the prescription that they get from the physician's office. So that's the change that we are making. It's a technique called motivational interviewing, and all of our coaches get trained on that. 4 times does the magic. So this is what we have found, that as people make change, how many interventions are necessary to kind of get that change going. And we found that if we were to talk to people 4 times in that process, they made statistically more significant change. And this is a study that we actually did with Dr. Palaniappan. And we've been talking about, the impact of health coaching. And this was really good because now we know if somebody's connected with us at least 4 times, we'll start seeing that change. And we are tracking the data now to provide more, to this. And the last thing, that's really the most important thing, is that life happens. Expect the unexpected, and people have to be with us even while the ride is bumpy and rough. Because life happens constantly. People tell us that, I'll go get screened 3 months from now, there's too much happening in my life. And to them, I have only one message, which is do it now and enjoy the next 3 months that are happening, because you would have changed for the better, right? So that's something that has really stuck on, and we go slow to be fast, really. So here is the question that we ask individuals when they tell us of all of the things that they can do. So we ask them, so what now? And that's our standard question for them. So here today, I request all the physicians in this room, would you consider augmenting your lifestyle RX? Exercise and diet is always on your prescription, which is great. Would you add it with the meditation and sleep, the meds that we talked about? And direct that prescription to the right pharmacy. When there's a statin to give, they go to the pharmacy, they pick it up. When you're talking about lifestyle, send them to a pharmacy as well. And the South Asian Art Center is one, but the SKN Foundation and the work that they are doing here is another as well. That really needs to be that collaboration, because this prescription doesn't get fulfilled otherwise. Thank you so much.